Place items to be used within easy reach, including a trash can for disposables. Wash hands thoroughly with soap and water or 70% proof hand sanitizer. Put on gloves. If preferred, put on 2 pairs of gloves for quick and easy glove disposal. Explain procedure to patient. If the patient's bed is adjustable, raise the entire bed to a comfortable height, usually lower than your hips. Lower the head of the bed as far down to horizontal as the patient can tolerate. Set up new brief and chuck in arm's length for future use. Unfasten the straps, velcro, or adhesive tape of the brief, and then tuck the side furthest from you under the patient's hip. Using pre-moisturized wipes or skin cleanser and disposable cloths, clean the patient's peri area, front to back, as thoroughly as possible. If patient can tolerate, cross their leg closest to you over the other leg. With one hand on the patient's hip and the other on their shoulder, roll them away from you onto their side. You might find this easier with the help of another able-bodied person who can then hold the patient on their side while you work. Using pre-moisturized wipes or skin cleanser and disposable cloths, clean the patient's perianal area front to back as thoroughly as possible. Place the soiled brief into a plastic grocery bag or trash can for disposal. Remove and dispose used gloves and replace with a fresh pair. With the patient still on their side, check the skin for pressure sores, which are also known as bed sores or pressure injuries. If ordered, apply barrier cream to the patient's perineum to moisturize and protect the skin. After allowing the patient's skin to dry, roll up one side of the new brief and tuck it under their side. Flatten and position the rest of the brief on the bed. Roll the patient back toward you onto the brief and then pull out the rolled up side of the brief. Remove any wrinkles and fasten the brief as directed by the manufacturer. Remove your disposable medical gloves and place them in the plastic grocery bag or the trash can. Wash and dry your hands thoroughly. If the patient's bed is adjustable, return it to the lowest position and raise the head of the bed to desired level. Cover the patient with a clean sheet or blanket as desired.